Best forms of magnesium for anxiety and depression based on work of Dr. Chandra, a Harvard and Yale-trained psychiatrist. Magnesium's beneficial effects on mood and stress are so well known that the mineral has nicknames like the original chill pill and nature's Valium. However, many people are on low doses of magnesium or take forms of magnesium that are not well absorbed by the body. It's no surprise that they don't notice any benefit in their anxiety, stress, mood, or sleep. How does magnesium affect mental health? In addition to anxiety, low magnesium levels have been linked with higher levels of stress, depression, insomnia or sleep disturbances, headaches or muscle pain, tightness, fatigue. Magnesium plays two important roles in the brain, which may contribute to these symptoms. It blocks the activity of more stimulating neurotransmitters and binds to calming receptors, resulting in a more peaceful, resting state. It helps to regulate the release of stress hormones like cortisol, acting like the brake on your body's nervous system. Which foods have the most magnesium? While it's beneficial to build a healthy diet with all of these foods, leafy greens are the best source for magnesium and overall mineral intake. While diet is the starting point for increasing mineral intake in general, it may not be enough for some people with mental health conditions, because of modern-day food cultivation. Farming processes have depleted magnesium and other minerals from the soil, and the techniques used in food processing can deplete magnesium levels by up to 80%. Factors such as genetics, metabolism, health conditions, and more can influence how much magnesium an individual person needs for healthy functioning. Those with anxiety, depression and insomnia may need more magnesium than they can feasibly get from their food. There are two main factors to consider when choosing a form of magnesium. Bioavailability, which indicates how much magnesium can be absorbed by the gut. Access to the brain, as effective forms of magnesium have to be able to cross the protective blood-brain barrier surrounding the brain. The two most commonly prescribed forms of magnesium, magnesium oxide and citrate, have the lowest bioavailability of the various forms. This means that they are more likely to pass through the gut and cause loose stools and diarrhea, so they are best used to relieve constipation. Magnesium salts like carbonate and sulfate have similar issues with absorption. Magnesium taurate. Magnesium taurate contains an amino acid called taurine, which has a calming, neuroprotective, and anti-inflammatory effect in the brain. Taurine also appears to help the magnesium enter the brain. In addition, it is gentle on the GI tract, making it unlikely to cause loose stool and diarrhea. Magnesium threonate. This form of magnesium has impressive studies backing its use in mental health conditions and has evidence that it can cross the blood-brain barrier. However, it can be more expensive and may require taking 2 to 3 times more capsules than other magnesium supplements to reach a sufficient therapeutic dose. Magnesium glycinate. Glycine is an essential amino acid that has important neurotransmitter functions in the brain. Glycine supplementation can improve the quality of sleep, making this form of magnesium a good choice for those with insomnia. Preliminary research shows that magnesium glycinate can elevate levels of magnesium in brain tissue. Like magnesium taurate, the glycinate form is gentle on the GI tract. Magnesium malate. This is one of the better absorbed forms of magnesium, which increases both serum and muscle levels of magnesium. Preliminary research shows that it may be effective in treating symptoms of fibromyalgia and chronic fatigue, as malate is involved with energy production. Based on current data, magnesium taurate and glycinate have the most research supporting their effects on anxiety and other mental health disorders. Magnesium malate and threonate have also demonstrated therapeutic effects and may be useful in many psychiatric cases. Magnesium citrate has some evidence of entering the brain, but only at significantly high doses. How much magnesium is needed for anxiety or depression? At this time, we don't have enough research to determine the best dose of magnesium for mental health conditions. Recent research indicates that doctors likely need to use higher doses of magnesium for many psychiatric patients than we previously thought. Most supplement labels and nutritional organizations recommend taking about 320 milligrams of magnesium, which is the recommended dietary allowance set by the FDA. However, this is based on the nutritional needs of healthy individuals and does not take biochemical individuality or pre-existing mental health conditions into account. Stanford recently conducted a study using 1,800 milligrams of magnesium threonate in older patients to evaluate its effect on executive functioning and memory. For those wondering how much is too much magnesium, the European Commission found that doses greater than 2,500 milligrams could result in toxic hypermagnesemia, i.e. too much magnesium. Anyone taking magnesium supplements past the recommended daily intake or along with other medications should always consult with a physician or other medical professional beforehand. Magnesium is generally very safe, and serious side effects and toxicity are both rare. For most people, the body efficiently handles excess magnesium by eliminating it through the stool, which is why the most common side effect is loose stool or diarrhea. Although it is very rare for magnesium to reach toxic levels, signs of toxicity include a fall in blood pressure, lethargy, confusion, heartbeat disturbances, dizziness, muscle weakness, and trouble breathing. Patients with impaired kidney function are at higher risk for adverse effects of magnesium. Magnesium can also interfere with certain drugs, including various antibiotics and medications for diabetes or high blood pressure. Using the right form and dose of magnesium is like using the right key to open a lock. Based on the current data, magnesium taurate and magnesium glycinate are two of the better options that may help those with mental health conditions. Psychiatric patients may also need more magnesium than the average individual but should consult a medical professional if their intake exceeds the FDA's recommended dosage. Magnesium is best used as a part of a comprehensive treatment plan along with a proper diet, stress reduction techniques, and treating the root cause of your symptoms.